Good morning, everyone. It's wonderful to be here and talk about what's happening in AI from a healthcare perspective. And quite an impressive gathering. When I was walking in, I realized that it's like there's so many people who are enthusiastic about AI, and there's so much work which is happening in this particular space. I'll give a quick background about what Portea Medical does, so you have an idea about the context in which we are talking. So Portea is India's largest outside the hospital healthcare services company. So basically, what that means is that people go to hospitals for all the tertiary care, and they go to clinics to meet doctors, and of course, everything, all the healthcare needs which they have post that in the comforts of their home or at their workplaces is managed by us. Of course, there are 4 key segments in which we work. There will be primary care, post-operative care when people get discharged from the hospitals, elder care, and chronic disease management. And what we are seeing, some of the other statistics, we are the largest player, footprint across 40 states in the country, 40 cities in the country across all the states. We have served over 1 million patients so far, and continue to serve around 20,000 patients a month right now as we speak. Work with all the large partners across the country, across all the ecosystem players in healthcare, whether it's hospitals, insurance companies, pharmaceutical, and so on and so forth. And of course, on the right-hand side, if you see, that's the range of services which we provide. So physiotherapy, post-operative care, diagnostics, elder care, diabetes management, cancer care, those kind of things which we are providing services to the patients across the full spectrum of the care in the comforts of their home. Last count, we spent close to 1.5 million hours in patient homes every month. And work with them to basically provide them the best of the care, the world-class care, which is possible. We have good hospitals in this country now, corporate hospitals which are taking care of patients' tertiary care needs. Of course, the same world-class healthcare should be provided at homes, and that's something which we have aimed to do and have been doing it for over a period of time. Of course, technology has changed in the last 20 to 30 years, and we are discussing this just before me, the last speaker was talking about. If you look at last 30 years in India, right, we had the first big change when the satellite TV came in 90s. Okay, that was a big change. We had access to so much more information which was coming to our living rooms and our drawing rooms and so on and so forth. Then, of course, early 2000s, internet came. Of course, that information moved from your TV to your computers. And late 2000s, of course, 2010, in that decade, we got mobile phones. The information came into your pockets, correct? Now, what is happening in this with the advent of AI and all the digital and the data collection which is happening, the information which will start coming to you or which is coming to you now will be more and more customized about you, is more and more relevant for you, right? So you had basically the way information is disseminated to you and the way information you can use for yourself is continuously becoming more and more and more personalized. If you see healthcare of all the verticals of all the businesses, healthcare is something which has been a lot more generic over a period of time. And the big change which you see in healthcare from the industry perspective, the change is happening from getting it to making it more and more personalized about you in general, right? Because healthcare, a cancer patient is a cancer patient, and everybody looks at how we treat them. And then, of course, how do you look at each individual's case? How do you basically treat them? How do you surgery or other procedures? And then how do you take care of them in a very personalized manner, right? And that is something which is becoming very, very critical as we go along. And that's where, if you see from AI perspective, the AI can make the biggest change in making healthcare very personalized to you, correct? So far, we always look at healthcare in a very, very generic manner, but I think the time has come where with the uses of data, with the usage of point-of-care devices and AI, you can make healthcare very, very personalized. And I think if you look into the future, 10 years from now, 15 years from now, the biggest change will be that how do you interact with your patients, how do you collect their data, and how do you make sure they have access to their healthcare plans as an individual's healthcare plan and not a generic healthcare plan. And that is something which we have done over a period of time, of course, largely using technology. And I see a lot more acceleration in that happening with all the new tools which are coming into play. So, of course, we know that AI is revolutionizing the global healthcare. The market is growing significantly. A fifth of healthcare organizations are already using AI in some form or other, right? The predictive AI tools could reduce hospital admissions by half. And if you look at, when you look at healthcare, you look at the healthcare ecosystem, you look at each of the players and what is possible over there, right? And of course, the discovering new drugs, the cost could be reduced by over 70%. These are some of the large predictions large potential areas which we have from the use of AI in healthcare perspective. And these are top use cases if you see. AI in healthcare is medical simulation, drug discovery, which is very important for pharmaceutical companies, medical chatbots, which is something which has already started picking up. When COVID happened, the first wave, it was something very, very new. Nobody knew what kind of symptoms to look out for, what to do. And it happened in early 2020. We worked with Goa government at that time and created a chatbot, which patients could use or consumers could use. They could reach out to their chatbot. All the information is stored over there, and they could basically interact with that and get all their queries answered on COVID, actually. And that was, of course, the advent of it. And then, of course, COVID became much more severe than that. But if you look at the uses of technology, and we saw that while we worked with many governments at that time, how we could use technology, how we could use basically data which you're collecting remotely from the patient and use that basically over a period of time to create personalized care plans for each of the individuals. I think that's something which is a massive changes. So chatbot is something which is being used quite actively now. And as I mentioned, we started using it during COVID time. Medical imaging is a big area. I think if you see from medical imaging perspective, a lot of activity in India, abroad is happening on how you can use AI in radiology, how you can use AI in pathology, and how you can use some of these things to improve efficiency. And I'll talk about it, the use cases as we go along. Medical research, of course, makes very strong case for use of AI. I think that's something, again, data-driven, consumer-driven, patient-driven. Again, the more data you collect, the more possibility of using AI over there and making predictions. Patient care, which if you ask me from perspective of all of you, all of us as consumers and, of course, AI practitioners, this is the most important thing. End of the day, you are the one, as a patient, whose health has to be taken care of, right? And it doesn't matter which part of the healthcare requirement you are at, whether you are at ICU set up in the hospital, ICU set up at home, you have a chronic disease to take care of, you have a physical ailment like probably the pain in the back or pain in the knee or whatever else has to be taken care of, rehabilitation, primary care, any of those things which are there. End of the day, all the roads lead to you as a patient, as a consumer. And the only way you can use AI at a generic level and, of course, at a personal level for individuals also is just by collecting more data, correct? So you have to be with the patient at the time what problem they are facing, basically connecting with them, using connected devices, collecting data regularly, and then seeing what you can do basis that data to create plans for them, right? And taking it back to ancient days in Ayurveda, you have patients' profiles, right? Kapha, Pitta, these are different profiles. And what probably AI will do, they'll also create generic profiles like that for different consumers, different patients as we will go along. And that's what we'll see from a patient care perspective. Disease diagnosis is a big area. We'll talk about it as we go along. And of course, personalized treatment plan. As we get the data together for a particular patient, for a particular consumer, how you can create the personalized care plans for them. And I think that's where the holy grail of using AI in healthcare lies. That's where all the efforts which you are seeing will probably lead into that direction. So what is happening in India? Actually, in India market, of course, is very different from the way you will see rest of the world. So what is the biggest healthcare challenge in India? Any guesses? Of course, no records. Accessibility, yes, very good. Yes, volume of data. So I'll tell you what are the two big issues in India. India's the biggest issue is we don't have enough qualified clinicians for the population we have, right? For every 1 lakh citizens, India has 64 doctors, okay? The worldwide, the developed countries average is 150. Now, what do? Can you move from 64 to 150 by adding more doctors? Of course, it will take its own time, right? If you, I don't know if any doctors are over here, it's probably the longest graduation which happens in this country, right? Many of us become graduate in 3 years, 4 years, and then we get onto the job. Medical graduation happens over a period of time before you really start practicing. So you cannot create so many doctors, right? So what do? Of course, you use technology. Of course, telemedicine has been the talk of the town for last 2 to 3 years. And then can you take it forward to the next level? So how do you basically help a clinician, help a doctor to treat a lot more patients than what he's doing today? So this ratio of 64 to 150 is how you bridge that. And then 150 will not be relevant in next 5 years because people are living longer. People are living longer, but they're also living longer more unhealthy. They're living longer with more chronic disease, correct? India is the diabetes capital of the world. India probably is the unannounced hypertension capital of the world, right? So number of patients just by sheer volume is very, very high in this country. So how do you take care of that? You take care of that by using technology. And then, of course, using technology, you collect data. And using data, you basically create personalized plans. So that's something which is very, very critical. And second, somebody said, which is, again, very, very important point, accessibility. India is not one country, right? India is probably many. And we have been working in, as I said, 40 different cities. And we also learn each of these cities behave like different countries. Just by sheer population, many of our big cities are bigger than many of the developed countries, right, from population perspective. But even if you look at from different states, and if you look at different cities, the kind of care available in a Bangalore versus Mysore versus like another location, what we call a tier 3 town or tier 4 town or rural area, right? 70% of India's population lives in tier 4 towns and rural areas. And the level of care over there is quite low compared to what you're getting. So what we see, Apollo Hospital, Manipal, right next to us, available to us to get taken care of, the access to the healthcare in those kind of cities and areas is very, very poor, right? So how do you make sure that you bridge this divide, actually? The inequality which is there in healthcare, how do you bridge that? That, again, will get bridged only by using technology. And some bit of that already started happening in last few years. Last 2 to 3 years, especially post-COVID. I think COVID was a big wake-up call for us as a country to start investing in healthcare. India said that we'll invest. Government said they will double the healthcare spends as a GDP percentage. And of course, a lot more action has happened. But now what we are seeing happening and should happen more and more will accelerate is that how do you use technology to make sure that remote healthcare is taken care of. So I would say those are two very, very critical points from India's perspective. How do you basically increase the clinicians' efficiencies? And how do you make sure that accessibility is available for everybody, right? So these are some of the key points. Of course, it just started picking up from a market perspective. India healthcare market is fairly large, close to 400 billion as we speak. AI expenditure is very, very nascent stage, will grow by all the projections, will probably add to $1 trillion economy to India by 2035. And of course, it's already getting integrated into diagnostics algorithm for screening the diseases, which is basically cancer, diabetes, which are, of course, the two big ones where a lot of work is happening. And of course, a lot of radiology where a lot of good work is happening in India. So this is how the AI-powered healthcare data will play out. Of course, you do diagnosis, you design the treatment prognosis, design the treatment course, clinical decision systems, do remote monitoring, and I'll talk about that. And of course, reduce adverse events using that and improve care quality. End of the day, what you are doing, you are helping your patients to take care of their health much, much better. And many of us probably use that today as even we are not patients. I mean, we all use these smartwatches, right? This smartwatch is doing nothing but collecting data on your primary health parameters. Now, with using that over a period of time, it can be predicted on how your health will be from a cardiovascular perspective, from diabetes perspective, how each of those things will play out for you as an individual, right? And you will look at it, everything will finally come back to you as a consumer and your data getting collected. I think the single most important thing is that at what level you are comfortable as a consumer, as a patient, and how much data you want to get collected, right? And I can give you examples. If you see ICU care, right? India has very little, I think 20 lakh beds across the country and maybe lakh ICU beds, right? And you probably requirement is 10x of that. And now how do you take care of more ICU beds? Okay, you can create also physically more ICU beds, but can you create more doctors to take care of them? No. But if you invest in technology, and that's what some companies are already doing in India, and using technology, using data, can you manage, can you monitor 10x more ICUs with the same set of people? That's what is something which is happening. So if you're looking at data collection from ICU patient perspective, we ourselves run at any point in time 150 to 200 ICUs at patient homes, correct? Because patients who discharge from hospitals either for end-of-life care or they discharge for basically rehabilitation, we set up ICUs, hospital equivalent ICU at home for them. And you manage it remotely using doctors in our regional centers, doing the round-the-clock monitoring where required, providing the medical care with the patient next to them. And you can collect the data and work with that patient on a real-time basis on how you can improve their health while they recover, right? So that's one end of it. Second end of it is, of course, primary care perspective, which you are talking about, all of us using smartwatches and seeing how we can do it in a preventive manner. So, of course, you can do it in a curative manner, you can do it in a predictive manner, and that many of you are already probably using that, and that data can be very useful for you to create your consumer profile from a healthcare perspective. I think that is something which is a big change, which is in offing for us, and will probably democratize the way we are doing preventive healthcare for all of us. What are the top use cases of AI in healthcare which we are seeing in action right now? These are possibilities which are there. I mean, there's cancer care I was talking about. There are companies in India already. Nerama is a company. We work with them. They basically use AI-based medical devices to detect breast cancer. Okay, and this is becoming a screening now. If you look at 5 years, 10 years before, each of these things you had to go to a hospital or clinic. Today, these things are available at a workplace. These things are available at your home. Actually, many of these technologies we are bringing to patient homes from a screening perspective. But the power of it is that when you screen it, the data gets collected, and many of the devices, I'll talk about it from a diabetes perspective and everything, the data can be collected on a regular basis, on an ongoing basis, and the patterns can be created. And again, as I said, the holy grail, the customized individual treatment plan can be created. And that's something which will help you as a consumer. Similarly, on the cardiac side, we are looking at Microsoft is working with Apollo hospitals, creating a machine learning tool to better predict heart attack risk, right? Some of these things, we didn't know how it was or how it basically plays out. It all has been a black box for most of us. But today, technology and healthcare, and of course, technology-enabled healthcare is available for you as a tool to leverage, as I said, for managing your health better, managing your wellness better, and predicting your sickness, your illnesses over a period of time, and how do you prepare yourself for managing those risks as you go along. And that's the biggest change technology and AI is bringing in healthcare. It's giving power back in consumer hands. Today, when you buy a phone, you basically do all kind of research, all kind of work, everything. But healthcare, in most of the cases, is a black box for most of us. When you fall sick, we go to the doctor tells us a diagnosis, say, this is what you need to do, this is how it will play out, right? Today, you can start working on your own health, your own healthcare, a lot more proactively than whatever we have done in past, actually. And that's a big change, which again, AI is bringing for all of us. Cancer markers is another area. Blood infection is something which is happening. Diabetes management, I think, as I said, India is a diabetic capital of the world. And we are seeing a lot of action happening on diabetes side. There's something called as continuous glucose monitoring patches, CGM patches, which are available, which you can just apply on your hand or on your waist. And it basically looks at your sugar patterns throughout the day based on what you are eating, correct? What you're eating, what you're drinking, it continuously looks at the data. And with a reader, you can get the data together. And your doctor, over a period of time, can create patterns and, of course, can predict using basically what kind of food causes spikes, what kind of exercise causes different spikes for you, because each food will cause different spikes for different people. This is a medical condition and genetics, right? But that is something which can be democratized today. And everybody who probably has a more chronic case of diabetes now is looking at using CGM patches, correct? Some of my friends use it and are so excited. It's like a toy, right? I've got a toy to play with. I mean, I've applied it here and I can see it on my phone of how my sugar readings are playing out, right? Earlier, with a glucometer, you probably did best case twice a day. And then, of course, you send it to a doctor who will read it or to a nurse who will read it. Today, you can see it for yourself. And that, I think, is the biggest change. As I said, Holy Grail, patient, your power of your healthcare is coming into your hands, right? And and diabetes is a very good example, because chronic disease is one area where AI will play a very, very big role. It's just making it more efficient, making it more in hands of the patient. I think that's a big change which we are seeing. And a lot of good work is happening in this space. I mean, in India, a lot of good work is happening in diabetes management. Worldwide, of course, all chronic disease management is happening. We have just launched a program for a smart heart, right? This basically what we are talking about diabetes, we are trying to do the same thing from a hypertension perspective. So you have basically a BP monitor, which is a smart BP monitor, will basically collect all your data. And again, you can do it over a period of time, because heart attack and having a healthy heart is becoming more and more critical in today's stressful times. And that's something which we launched. And you will see a lot more action like that. Sleep studies, your sleep patterns. We don't talk about sleep as a chronic disease, but if you look at sleep, sleep is a big chronic disease. Most of the people sitting in this room probably don't get great sleep, actually, for 7 hours uninterrupted, right? And that is something which will cause a lot of issues as you go along. How do you take care of that? They're connected sleep devices, which can monitor the way you are sleeping and the quality of your sleep and what you need to do to improve that as you go along. So again, all preventive healthcare with advent of technology and AI is coming to your own homes, which you can choose to use to your comfort level, right? Not all of us want to be wired all the time, whether it's basically wire or wireless. I don't want all the time data to be collected about me. I mean, of course, and that's the next segment of saying, what in healthcare, the data security, data privacy becomes a lot more important, but depending on your own choices, you can basically invest into managing your healthcare using AI, and of course, a doctor can work on top of it. AI and drug discovery, I mean, of course, some work has started happening in that. We are all familiar with Moderna's COVID vaccine. Of course, there are all kind of questions being raised on the efficacy of the vaccine and what are the side effects it's having in people's cases now. But irrespective of that, for the first time, probably a vaccine was created in months. I mean, many of the earlier diseases, the vaccine get created over a period of years, correct? But I think now we are seeing vaccine getting created in few months, and that probably is the big change which you are seeing. And from a drug discovery perspective also, you'll see a lot of changes as you go along. It will shorten the cycles. It will improve the efficiency. Of course, effectiveness of the vaccine, effectiveness of the drug, of managing the disease will only play out over a period of time. But of course, from efficiency perspective, you'll see a lot of changes which are happening now. This is some of the conversational AI in healthcare, which is already being done. Okay, and this, of course, the uses of AI, which has started happening. You can see a lot of examples I have posted over here, where people have patient consultation, the response to FAQs. That's something which is, again, getting into your own hands. You can basically get all the responses at a broad level from using the chatbots, using the consultations, using AI. The online symptom checking is very important with preliminary diagnostics, as I talked about. Voice-enabled health assistant, something which is happening, speech recognition bots. And many of these things are horizontal uses of AI, which are also getting implemented into healthcare. A doctor, all the non-clinical work which the doctor is doing in terms of collecting patient data, analyzing patient data, talking to the patients, all of that can be automated or can be basically scaled much faster using AI. And that's something which is already happening in hospitals, and some of the new age technology companies, healthcare technology companies are doing that. Then doctor's time is freed up basically to do the real treatment, right? To basically do the real prognosis and work with patients on basically creating the treatment plans. The healthcare operations, I think what is happening, if you see from a hospital perspective, again, we are seeing in action. How do you manage patient flow? How do you manage staffing? How do you manage scheduling? How do you manage supply chain management? Again, generic AI solutions which are getting created, which could be, of course, applied to healthcare as a vertical. But this, again, will help you to manage hospitals much better, much more efficiently, and in turn, freeing up doctor's time to basically work on what he's supposed to do. Not the administrative task, but more of the clinical task. And other clinician staff also. If you see in India, the nursing capacity is very, very less, right? So how do you basically, and we provide home care. We have thousands of nurses in patient homes across the country. How do you get more and more qualified nurses, and how do you make sure that, quote unquote, you can multiply their efficiency, you can multiply their work, right? And you can do that by using technology, by using point-of-care devices. That is something which we are investing in a lot, and that's another area which I wanted to talk about. The point-of-care devices in terms of diagnosis, in terms of collecting the data, in terms of alerts, in terms of working with a clinician round the clock to make sure that the patient's health is taken care of, or consumer health is taken care of, is happening a lot. There are a lot of investment happening in point-of-care devices. There are 3-lead ECG machines, there are BP machines which I talked about. Of course, diabetes management, which is available from a continuous monitoring perspective. So each of these devices, which probably you went for getting screened with to the hospitals and to clinics 5 years, 10 years back, are available in your homes. Of course, the effectiveness of each of those is improving as we speak. So not all of those are hospital grade today, but all of those will get to that stage over a period of next 3 to 4 years. But I think the revolution around that has already started. And that's where you will see the big changes happening. So any of you are looking at leveraging AI from healthcare perspective, creating solutions from your clients. End of the day is all going to be with the patient, with data collection, building, of course, the algorithm which can work on that data to get the right solutions, the treatment plan for the patient. But end of the day, a lot of that will happen from creating point-of-care devices, taking it to patient homes, and collecting data. And that's something which you are seeing, again, major changes happening, of course, worldwide, as well as in India. There are companies in the US which are able to, doctors able to basically look at the patient, do the full diagnosis, sitting in their clinics now, right? And these are basically diagnostics devices which are giving hospital-grade evaluation of a patient condition without necessarily going to the hospital. And I think that is something, with over a period of time, technology will evolve, and that will become more and more commonplace. Of course, these are potential pitfalls to look out for. As Spider-Man said, with the great responsibility, with the great powers come great responsibility. And AI is giving you the great powers, right? And in healthcare, it's giving you real private power over your patients, over your consumers, right? Nobody wants to talk about that they have diabetes. If I just asked in this room how many people are diabetic, even if people are, they will not raise their hands because we don't want to talk about it, right? Because it's not something which we wear a badge on saying that, okay, I'm diabetic or I'm hypertension or what, I have hypertension and things like that. And many of our patients, or I had cancer 3 years back or whatever else, right? Healthcare data is probably the most private data, as private data as your banking data, right? And that is something which is the biggest pitfall of the whole investment of AI in healthcare is about how secure you keep patient data. Of course, India still doesn't have all the rules and regulations. Is basically getting built right now. Next 2 to 3 years, we'll have a lot more stringent data privacy rules in India also, especially around healthcare, but that's something which is very important. How do you take care of patient data, and how do you make sure it's basically privacy is maintained in that? Of course, data gathering complexity. All of us have different fingerprints, right? All of us have different body compositions. So healthcare is very unique to every individual. So in this case, the data getting used or the wrong models getting built, given the data set, and India, as I said, is a very large country, right, with very different kind of people in different geographies, different eating habits, different disease habits, and different diseases and patterns, and so on and so forth, right? So how do you make sure that you use the right data set to create the prognosis, to create the models? That's, again, the second very big pitfall, which is possible in this. And those things have to be taken care of in terms of if we want to leverage AI fully in healthcare, and get the best outcome of it. These are some of the pitfalls we should look out for as of course, as a community, as well as a country. So the way I look at AI movement in India, in healthcare specifically, I think a lot of action you will see in next 3 to 5 years happening in improving efficiency of the clinicians, improving efficiency of the healthcare professionals. That's something where major investment will happen, and major results will come. So our doctors become a lot more efficient. Second area, of course, will be in terms of accessibility. How do you use data across how do you use technology across the country and provide healthcare in more and more remote areas? I think that's second thing which will become very prevalent. Third, of course, will come into chronic disease management, as we're talking about, whether diabetes management, hypertension management, all those chronic disease cases, again, will have significant investment in AI because that's where results will be shown the fastest. Okay, and in terms of effectiveness, I think that's the next phase to play out. I think that probably how to make treatment plans more effective, how to look at the patient condition and give the first diagnosis and the treatment plan, and then follow that through. That's probably the phase 2. But making healthcare more personal, using AI to make the healthcare the whole ecosystem lot more efficient, I think is going to happen in next 2 to 5 years, and big changes are already into works, and it should result in us being lot more aware about our health, lot more proactive about our health, and lot more careful about our health. So with that, we come to an end of my deck. Any questions? I'll be happy to answer.